Hi guys, my name is Heather, and I'm here today to talk to you about major depressive disorder. You might see in my slides that I refer to this as MDD. Today we are going to talk about what is major depressive disorder, signs and symptoms, both mentally and physically, who is at risk for major depressive disorder, diagnosing MDD, recent research done, treatment, and a case study for a patient. What is major depressive disorder? It's a common but serious mood disorder, and it's often referred to as clinical depression. It can affect how you think, feel, and handle everyday activities depending on the severity of your major depressive disorder. It can affect someone both mentally and physically. Unlike short-lived sadness, it's a persistent and intense feeling of sadness for an extended period of time. According to the Journal of American Medical Association, the lifetime of incidence of depression in the United States is more than 20 to 26% for women and 8 to 12% for men, which this is a high percent. Signs and symptoms of major depressive disorder: mentally, feeling persistent, sad, empty mood, hopelessness or pessimism, feelings of worthlessness, difficulty concentrating and making decisions, whether it be in your household, at the workplace, in school, loss of interest in activities that you once enjoyed doing, and irritability. Next, we have the physical symptoms, which could include fatigue, headaches, digestive problems without clear physical cause, weight changes, whether this is weight gain or weight loss, and possible joint and limb pain. Now that we talked about the signs and symptoms, let's talk about who is at risk for major depressive disorder. It's a combination of genetic, biological, environmental, and psychological factors. This could happen at any age, but most often happens in adulthood. Just a fact, suicide is the third leading cause of death for young people ages 15 to 24, which is a very alarming fact. Those with other serious medical conditions, family history of depression, major life changes or trauma or stress, which could be a car accident, a death in the family, or a major move. More females versus males, and this is due to self-esteem and body issues that females experience versus males, and those with poor peer relationships and low quality support systems. Next, we're going to talk about diagnosing major depressive disorder. Most of the times, the doctor does a physical examination and lab tests to make sure symptoms are not related to a certain condition other than major depressive disorder. We first have a psychiatric evaluation, which the mental health professional asks about symptoms, thoughts, and feelings, and this is usually done through a simple questionnaire. We then have a depression screening instrument, which one would be the Patient Health Questionnaire, also known as the PQ-9. It's a 9-item self-administered diagnosis screening. On this next page, it's just a severity score. So for example, if the patient score was from 5 to 9, they would express minimal symptoms, and the treatment recommendation would be support, educate to call if worse, and return in 1 month, so not so severe. If the score was above 20, it would indicate major depression severe, and treatment recommendations would be antidepressant and psychotherapy, especially if not improved on monotherapy. We're going to go back to this slide. And lastly, we have the DSM-5, which is published by the American Psychiatric Association and may use the criteria for depression. We now have research on major depressive disorder done by Stanton and Rayburn in Exercise and Treatment of Depression. So 60 older adults with major depression were supervised moderate to high intensity resistance exercise versus low intensity resistance training. The results from this showed that the moderate to high intensity program was a lot more effective than the low intensity program. And you'll see later on when I talk about a patient and an exercise prescription why I prescribed moderate to high intensity versus low intensity. Next, we have a different age group, ages 25 to 60, and this showed that an exercise dose equivalent to that recommended to the general population was more effective than a low-dose activity. So for both age groups, it showed that the moderate activity was a lot more effective than the low-dose activity. The method used for this was the Validated Depression Rating Scales. For treatment, first we have medications and psychotherapies. There's no one size fits all for treatment. Each patient is different and it depends on the severity and what the doctor feels is appropriate for that patient and safe. Even in the most severe cases, depression can be treated. So for certain medications, we have antidepressants, which help to improve the way the brain uses chemicals to control mood, and this usually takes 2 to 4 weeks to work, so it's not an overnight process. The problem with antidepressants is it can cause adverse effects, such as problems with sleep and concentration, reduced appetite, and lastly, severe an increase in suicidal thoughts. Some psychotherapies we're going to talk about first is interpersonal therapy. As the name speaks for itself, it focuses on interpersonal problems. It is highly structured and time limited, and it usually lasts from 12 to 16 weeks. Next, we have the cognitive behavioral therapy, also known as CBT. It helps clients to change their unhelpful thinking and behavior, which improves mood. This kind of therapy focuses on cognitive behavior and also on perception of the situation. Lastly, we have problem-solving therapy. This helps to teach the patient to manage the negative effects of stressful events. We now have treatment exercise, and I put this quote, "Being active should be a part of depression treatment." It first helps with physical and mental health benefits. It prevents and improves a large number of health problems, which could include high blood pressure, diabetes, metabolic syndrome, and many more. Next, it releases feel-good endorphins from the brain. I know when I work out, it always makes me feel better, so I'm sure that's the same case for other individuals. Reducing stress, which can take a person's mind off of their worries and ease in some of the symptoms. It depends all on the patient. Next, social and emotional benefits, which is just as important as mental and physical. It helps the person to gain confidence, such as appearance and stepping out of comfort zone, increase social interaction, and it gives them a chance to meet other people with similar conditions. And lastly, coping in a healthy way versus a destructive way, which means positively managing depression instead of engaging in activities that will worsen the symptoms, such as drinking or reckless behavior. I have another research done here, which is the long-term impact of exercise versus medication on depression. This was a study done by the Journal of Biobehavioral Medicine. It lasted 16 weeks of treatment, and 83 patients took part in this treatment. 6 months after treatment, they found that medication only, 38% relapsed, medication and exercise, 31% relapsed, and exercise only 8% relapsed. So from this study, we can see that exercise was the most beneficial versus just medication only. For our case study done, we have a female aged 28 years old, blood pressure 124/78, and a BMI at a normal range. Blood glucose levels at 89, so all of that is normal. For risk factors and lifestyle, we have a non-smoker, has family history with major depressive disorder, currently not on any medications, and used to do moderate intensity activities such as biking. So the only major risk factor has family history of major depressive disorder. For an exercise prescription, I have aerobic 3 to 5 days a week, 30 to 60 minutes per day, and 150 minutes per week. As I stated before, we're going to stick with the moderate intensity exercise versus the low intensity, and vigorous if able. This patient isn't on any medications, so vigorous as possible. Group fitness activities such as yoga and Tai Chi have been proven to help patients with major depressive disorder. And also, since this patient used to do biking, it would be highly considered that they do activities they once enjoyed. Lastly, we have resistance training 2 to 3 days a week, which includes active rest in between, moderate to high intensity versus light intensity, and this person can work with free weights or plate machines depending on the resources that they have. Flexibility and balance is important. 3 to 5 days a week, can stretch to some point of discomfort, hold stretches for 10 seconds, and walk heel to toe, take yoga, or sit to stands are some examples of flexibility and balance. So this patient is going to do a combination of aerobic resistance training and flexibility and balance exercises each week. Here we have some websites that you can visit in order to gain more information about major depressive disorder, and also some journal articles on recent research done. I hope you enjoyed my presentation, and thank you for listening.